Thank you for listening to Here's to Your Health, a podcast brought to you by the Crawford County Memorial Hospital. During this podcast, we talk about healthcare, the people behind it, and the opportunities that help shape the next generation of medical professionals. This podcast is where we share stories, insights, and conversations focused on healthcare and the people who make a difference in our community. Thanks for listening to the Here's to Your Health podcast. I'm Jill Melby. Today you're going to hear from our providers who work the extended hours of our medical clinic. Let's listen in. Sam, can you introduce yourself and the role that you play at the CCMH Medical Clinic?
Yeah, so my name is Samantha Pauley. I've actually worked here for 4 years. I am now a nurse practitioner here and seeing patients in our medical clinic.
So Sam, do you have an expertise that you see people for?
Yeah, I really will see anyone for anything they need to be seen for. I previously worked emergency and cardiology, so those will always be near and dear to my heart. I also love women's health, but I really, I love anything and anyone, so really anything.
Great. And are you still taking new patients?
Yes, I am taking new patients, established care visits, so I would love to see.
That's great. So during our extended hours, have you seen anything like with people coming in as this improved access for people to be able to get their appointments?
Yeah, I think it has opened up a lot of availability. One thing, is huge. We understand life is busy. Mm-hmm. And I especially get it, a working mom. It's not always easy. Illness, injury never happens at the right time.
Right.
So it's nice to have those available hours where you don't have to wait till the next day or, till the next available appointment, with sometimes during the, illness season can be multiple days.
Yes. Nothing ever happens when it's supposed to.
Exactly. I know, and having a family is just, you realize that, nothing ever is just cut and dry. Exactly.
Nothing's on schedule. Well, speaking of schedules, I know you've got lots of appointments scheduled today, but before you leave, what's one takeaway that you want the listeners to know and remember about the extended clinic?
Yeah, it's really just that we're here for you. Growing up and living in this community, I think of everyone like I would think of my family. So I really want everyone to know when they come in, you're not just a number, you're a person to us, and you mean a lot. So we would love to see you for anything and everything you need.
Aw, thank you, Sam. Yes. You have a great day.
You too.
Hi, I'm Kiaya Alderson. I am a new physician assistant out at Crawford County Memorial Hospital. I am part of the 3-person team that works in the extended hours. Right now, I am currently offering appointments to established care. This can be of any age, with any comorbidities. I am happy to see you. I emphasize working with the patient to reach your own goals. I'm here to help support you and provide the medical decision-making behind that. Together, I think that's where we find the best control of chronic management and any acute cases as well. The extended hours are typically used for acute cases such as I'm having a cough, I have a sore throat, I have a headache. These are the things that the extended hours mostly offer with myself, Sam, and Macklin.
And how have you seen extended hours improve access to our community?
I think this has helped a lot. People work during the day, there's school during the day. The extended hours allow for, I need a quick appointment before my kiddo goes to school. Mm-hmm. Do they have strep? Do they need an antibiotic? Can they go to school today? I think those morning appointments are wonderful for that, along with offering the appointments later in the day. We can see a lot of people needing those appointments to check in of, can I go to work tomorrow? Can I go to school tomorrow? Sometimes you just start feeling poor later in the day too. And so the extended hours really act as that urgent care setting to help look at those needs.
And then what's one takeaway that you want people to know about the extended care that we've been offering?
There are always at least 2 providers here in the extended hours, which I feel like provides benefit of getting to bounce ideas off of one another as needed. Sure. And so I think you can have more confidence that the quality of care is high, it's efficient, and we're just happy to see you, and offer that time frame.
Well, thank you, Kiaya. I'm here with Mac Conrad, and we're going to have him introduce himself and talk about his role at the medical clinic.
Yeah, so like she said, my name is Mac. I'm a new PA here at CCMH. I work primarily in a family medicine clinic. I see, all the way from kiddos to people in the elderly ages. I really enjoy spending time with I'd say the teenage years. Anywhere from the 12 to 18, I feel like is my favorite age group to work with. But I really enjoy kind of just getting to know the patient, getting to know why they're here, and then just seeing the best way that I can help them.
So extended hours have been going on for a little bit over a month.
Mm-hmm.
What kind of appointments have you been seeing during the extended hours?
As far as our extended hours, we really been trying to emphasize acutes more than anything. We do have some openings for med refills and stuff because we understand that, if you're working 8 to 5, it's not like you can always take off time to go get a regular appointment. So we do see some regular office visits, med refills from about that 5 o'clock to 6 o'clock range. But after 6 o'clock, we really try to hone in on the acute side of things. When it comes to the mornings, from 7 to 8, really open for anything. So if you guys need to come in for chronic care or acute care, coming in prior to work is also an option too.
What would those acute type of visits look like? What kinds of things would they come in for?
So acutes, at least from our standpoint, are things that we can really diagnose and treat within the same visit.
Sure.
So things like low back pain, while they may seem acute, and we can help you with it, it's really hard to make a significant diagnosis on low back pain aside from putting a Band-Aid on it. Things like abdominal pain aren't always acute. Sometimes it's a little bit more of a chronic issue, but things like your strep throats, your migraines, your headaches, things like that are more of an acute visit.
Great. That's probably helpful to some of our listeners.
Yeah.
So have you seen that our extended hours have improved access to care in our community?
100%, yeah.
Okay.
I feel like, honestly, when I look at my schedule in the mornings, I look at it and I'm like, okay, so I have patients for sure, I have basically my 5 o'clock to 6:40 is booked out right away.
Oh, wow.
And then I slowly get people that trickle in throughout, if they're sick and they're missing school, obviously, come in whenever. But I feel like my later half of the day appointments get filled up a lot sooner than my early ones.
Sure, so that access after work, after school for the kids so that they can get there and not have to miss work or school.
Yeah.
So what's one takeaway that you want our listeners to remember about the extended hours care that we have here at the clinic?
A big thing is, again, kind of realizing that, when we say acutes, we really want to be able to help you right away. And sometimes when you come in later, we obviously also have a little bit less staffing. So, if you ever need financial help with things, we don't always have financial counselors there.
Sure.
It makes it a little bit harder to do some of the diagnostic testing that we have. Another big thing is I feel like, we hit so much on the 5 to 7 at the end of the day. I feel like, that 7 to 8 can also be pretty well utilized too. I know people don't like waking up early, but we still do have those times, and I feel like for the most part we do have openings there.
Right, so they can come
days.
Before work or before school.
Yeah.
Well,
Yep.
Very good. Well, thank you for joining us today.
Of course.
Have a great day.
You too.
Thank you for listening to Here's to Your Health, a podcast brought to you by Crawford County Memorial Hospital. We hope today's episode provided helpful information and a better understanding of the care and services available in our community. Be sure to join us next time for another conversation on Here's to Your Health.